Fabrazyme is indicated in adults, children, and adolescents aged 8 years and older. Fabry disease is a progressive, X-linked lysosomal storage disorder that affects both males and females. Fabry disease is caused by a complete or partial deficiency in the lysosomal enzyme alpha-galactosidase A or alpha-Gal A. Early symptoms of Fabry disease, which can start as early as in childhood, may include pain, gastrointestinal disturbances, angiokeratomas, hypohidrosis, proteinuria, and other symptoms. As Fabry disease progresses, renal function deterioration and hypertrophic cardiomyopathy may occur, and the risk of developing fatal complications such as end-stage renal disease, stroke, cardiac fibrosis, arrhythmias, and premature death increases. In normal individuals, alpha-Gal A breaks down globotriacylceramide, also known as GL3 or GB3, and other related glycosphingolipids in the lysosomes, and there is no GL3 accumulation. In Fabry disease, mutations in the GLA gene result in defects in the synthesis and/or function of alpha-Gal A. Over 880 mutations in the GLA gene associated with Fabry disease have been identified. In general, these mutations result in either complete deficiency of the enzyme, detectable alpha-Gal A protein with no enzymatic activity, or some alpha-Gal A protein with residual enzyme activity. Residual enzyme activity is determined by the amount of enzyme that is produced and the functional activity of those enzymes. Complete or partial deficiency of alpha-Gal A leads to progressive accumulation of glycosphingolipids, particularly GL3, in the lysosomes of numerous cell types. Cardiomyopathy, vasculopathy, neuropathy, and chronic kidney disease can be some of the severe manifestations that result from GL3 accumulation in the vascular endothelium throughout the body. Fabrazyme is an enzyme replacement therapy, or ERT. It is a recombinant protein and serves as an exogenous source of human alpha-Gal A for patients with Fabry disease. The amino acid sequence of Fabrazyme is identical to the native human form of alpha-Gal A. The rationale for the use of Fabrazyme as an enzyme replacement therapy is to restore a level of enzymatic activity sufficient to clear the accumulating substrate in the lysosomes of various tissues, thereby preventing, stabilizing, or reversing the progressive decline in organ function before irreversible damage occurs. Fabrazyme is administered at 1 mg per kilogram once every 2 weeks as an intravenous infusion. It can be used to address complete or partial alpha-Gal A deficiency, resulting from all Fabry disease-causing GLA mutations. Alpha-Gal A is a lysosomal enzyme that is targeted to the lysosome via the mannose-6-phosphate receptor-mediated trafficking system. Mannose-6-phosphate receptors on the plasma membranes of cells also mediate the cellular uptake of Fabrazyme. After intravenous infusion, Fabrazyme is taken up by vascular endothelial cells and other cells with mannose-6-phosphate receptors and is transported to the lysosome. Fabrazyme contains consistent levels of both sialic acid and mannose-6-phosphate, two carbohydrates that affect the biodistribution of alpha-Gal A and facilitate appropriate lysosomal localization. In the lysosome, similar to the native human enzyme, Fabrazyme catalyzes the hydrolysis of GL3 by cleaving the terminal galactose residue from the molecule, reducing the amount of GL3 accumulated in the capillary endothelium of the kidney, heart, and skin. Fabrazyme 1 mg per kilogram every other week reduced mean plasma GL3 levels and capillary endothelium GL3 levels, shown here as the proportion of patients who achieved a 0 score within 6 months, and sustained levels in the normal range even after 54 months of treatment. Treatment with Fabrazyme resulted in rapid and sustained clearance of GL3 from the cardiac microvasculature over the 54 months. Accumulated GL3 deposits were reduced to normal or near normal levels when treated with Fabrazyme in renal mesangial cells, glomerular capillary endothelium, non-capillary endothelium, and interstitial cells after 6 to 12 months. Reduction in GL3 burden in podocytes and tubular epithelium were also reported. Clearance of accumulated GL3 from the endothelium of major organs that are affected in Fabry disease, such as the skin, heart and kidney, could lead to physiologic and clinical improvement. The diverse range of GLA mutations may explain the heterogeneous clinical presentation of Fabry disease. Fabrazyme's mechanism of action addresses complete or partial alpha-Gal A deficiency, resulting from all Fabry disease-causing GLA mutations. It aims to restore a level of enzyme activity sufficient to clear the accumulating substrate in various tissues. To learn more about enzyme replacement therapy with Fabrazyme and how it works, please speak to a Sanofi Genzyme representative.